It shouldn't come as a surprise to anybody that the NHS is in crisis. There's a report by Mark Berwick, who was the Deputy Medical Officer of the NHS England, and he has done a report together with the University of Birmingham, and they've looked at the university hospitals in Birmingham. There's 4 of them. The trust itself employs 22,400 people. And the report, which came out about 2 days ago, says that there is a toxic atmosphere in the Birmingham NHS Trust, the UHB. And it has impacted patients' experiences and their morbidity. So the death rate in the Birmingham NHS Trust is higher than it should be. And this follows a really tragic incident when Dr. Vaishnavi committed suicide last year on the 22nd of June. And it's, as she clearly mentioned in a note, why she was doing this, why she was so depressed. She complained about the working environment at the Queen Elizabeth Hospital in Birmingham, and she waited 3 hours for an ambulance and begged for them not to take her to the hospital in Birmingham. There are extensive complaints made by staff about the conduct of the organisation itself. Bullying at all levels, of course there is. If you see bullying in an institution, bullying is at all levels. If you see bullying in the playground at school, there is bullying in the staff room. Be in no doubt. Bullying is infectious. Bullying is like a disease. There isn't one single occurrence of it. It's invasive. And people learn from one another, and they see one another bullying each other. And it goes up and down the system. There's a range of issues in the NHS Trust about promotion, about the absence or the lack of nurses. 13.35% of nursing jobs are vacant. And the culture there is, the report says, it's morale sapping. It threatens long-term staff recruitment. It puts patients' lives at serious risk. And examples are given of the complete insensitivity of management. The lack, for example, of senior representatives from management at the funeral of Dr. Kumar last year, and the tardy letters sent by the NHS Trust to her family. Insensitive, stupid. Stupid, not just insensitive, stupid. My assessment, not theirs. They stop at insensitive. And another example of utter stupidity is a senior member of staff contacted Dr. Kumar on her email 26 days after she had died to ask why she was no longer at work. This isn't just insensitivity, this is stupidity. It's arrogance, it's bullying, it's almost incomprehensible. It shows an organisation that is dysfunctional. It also shows an organisation that does not care about its staff. It only cares about its bureaucracy. And this, I think, is a trope which can be identified around the country. The NHS staffing problem, not only the NHS, education as well. Companies which have got so big, they do not care. They do not care. Dave Rosser is the CEO of the University Hospital NHS Trust, and he has been personally criticised in the report, and we learn that he is now retiring. I don't think that's going to repair the damage. The damage goes so deep, and it's not just about one particular university trust. It goes throughout the system. The system needs an overhaul, and it's not just the NHS which needs an overhaul, it's education as well. It's the police force. Wherever bureaucracy has taken over control, human beings are suffering because we aren't bits of paperwork to be managed and moved around by uncaring pencils, by pencil shifters. And we need to come to terms with this, and we need to change it fast and significantly. So rather than looking for the bully in the cabinet room, the bully in the House of Parliament, the bully in the NHS Trust, the bully in the staff room in school, we need to think this is about an infection. Bullies are everywhere. A lack of caring is everywhere. Insensitivity is everywhere. So instead of looking for the negatives, maybe we should look for the positives which we can turn around and which we can improve. The positives we can build on.